I was like, that is clearly
And I'm sorry, this is Kyra again. We still have quite a few people trickling in, so I'm just going to give them a little bit more of a chance to do so. So I'll wait 1 more minute, I believe. Okay, it seems like our traffic has slowed down, so we will go ahead and get started. Good afternoon and welcome to the stakeholder listening session for the All Fair Claims Database Procurement Plan. I'm Kyra Morgan, State Biostatistician. On behalf of the Department of Health and Human Services, I call this meeting to order and verify that this meeting is being recorded. The recording will be made available. The agenda for today's meeting about the All Fair Claims Database Procurement Plan was posted on January 5th, 2022 on the Division of Healthcare Financing and Policies website and at notice.nv.gov. If you could move to the next slide, Leisha. First, I'm just going to go over a little bit of background information. This session will present information on the procurement plan for the All Fair Claims Database System. Regulations or the regulation process for Senate Bill 40 will not be discussed today. That's a separate process that will have opportunity for public comment at a future date. Really quickly, the team of presenters that you have today, again, I'm Kyra Morgan, I'm the State Biostatistician for the department. I also have Jake Dolly with me, Project Manager for the Division of Healthcare Financing and Policy, as well as Alicia Hansen, who is a consultant with Public Knowledge. And now I'm going to turn it over to Jake to facilitate public comment.
Thanks, Kyra. So good afternoon. I'm Jake Dolly. I'm a project manager with the Division of Healthcare Financing and Policy, which is within the Nevada Department of Health and Human Services. A couple of quick housekeeping items before we begin. For this session, there are a number of ways that attendees may participate. If you wish to offer comments, you may submit questions or comments through the chat box in Microsoft Teams. All comments will be recorded and reviewed by the state. Participants may also submit comments or questions to nevadahit@dhcfp.nv.gov. This email address will be shown again at the end of this presentation. At the designated time, spoken comment will be permitted. At this time, participants have all been muted. The presenters will notify the participants when the appropriate times are to volunteer their feedback. Participants must raise their hands during these times, and then a facilitator will invite them to unmute and share their comments. Comments will please be limited to 3 minutes. If you've joined by the Team app or through a browser, please use the Teams controls to raise your hand and to unmute yourself when invited. If you have joined audio only via dial-in, you may press *5 to raise your hand and *6 to unmute yourself when invited. If you need these features again, a list of all audio only commands is available by hitting *1. When invited to comment, please begin by stating your name and your organizational affiliation. Questions will be recorded and reviewed by the state and may be used to create a frequently asked questions or FAQ resource. And lastly, this session is being recorded and the recording will be posted with the meeting minutes. They may be accessed in the same location as the meeting notice and agenda at dhcfp.nv.gov and notice.nv.gov. At this time, we've held some time for opening public comments. If anyone would like to make a comment prior to the presentation, please raise your hand at this time. We'll give it just a moment for anyone who's struggling to find the raise my hand button. Alrighty, again, there will be another opportunity for public comment a little later in the presentation, but for now, back to Kyra.
Thanks, Jake. So for the record, again, Kyra Morgan, State Biostatistician for the Department of Health and Human Services. We did a little welcome and introduction, so I am going to jump into a presentation of the agenda. Today, we're going to go over at a very high level what is an all-payer claims database. You'll see that we're using the acronym APCD throughout today's presentation. We're going to talk about potential benefits to Nevadans, an overview of Senate Bill 40, APCD project at a glance, including a timeline and some information about the APCD grant, applicable recommendations for establishing an all-payer claims database, and then some key items related to procurement. So what is an all-payer claims database? All-payer claims databases are collections of medical, pharmacy, and dental claims data obtained from public and private payers. They may also contain eligibility and other related data. The purpose is to improve transparency and information about costs and the quality of healthcare. APCDs have been implemented in over 24 states, and some states mandate their reporting while others have voluntary reporting. Potential benefits to Nevadans. The APCD will contain data that's not currently available, such as combined claims from private insurers, Medicaid, and Medicare, both charged and paid amounts, including patient responsibility and dental claims. Senate Bill 40 requires a report be prepared at least annually concerning the quality, efficiency, and cost of healthcare in the state. And some examples of possible healthcare quality, efficiency, and cost reporting include actual patient costs overall and by condition or procedure, volume and cost of dental services, prescription medication costs and utilization. And just wanted to note here that SB 40 does not allow for data submitters to include direct patient identifiers in submitting their data, so we will be somewhat limited in being able to cross-reference individuals with other data sources within the Department of Health and Human Services. Next slide. Here's just a quick overview for those of you who may not be familiar with Senate Bill 40. It was passed during the 2021 legislative session, and it requires the department to establish the APCD to the extent that federal funding is available. It outlines requirements for regulations to establish an advisory committee for the APCD, as well as secure data submission. Again, just emphasizing the removal of all patient direct identifiers from the data, and also the assignment of a unique identifier to all data concerning a specific patient, which would not allow for that to be tied back to any kind of specific medical record. It also outlines requirements for data quality assurance and reporting and use of the data by state and other entities. Regulation development is also underway following Nevada's administrative rulemaking requirements, and opportunities will be available to provide input into that process separately. And with this, I think I'm going to kick it back over to Jake.
Thanks, Kyra. Yeah. So the first thing I'd like to do is talk a little bit about the project. So we've already assembled a project team from various units in the Department of Health and Human Services to conduct the activities required to create an all payers claims database, or an APCD as required by SB 40. Participants include, of course, Kyra as the Chief Biostatistician, her analytics team, as well as leadership, project management support, and IT expertise from the Division of Healthcare Financing and Policy, which is known as Nevada Medicaid, as well as Public Knowledge, who are participating as consultants on the project. The team has broken the project into 4 general categories of activities that need to be completed. The first is grant funding. Again, as Kyra mentioned, it is one of the requirements in SB 40 that we procure the grant funding for this. There was a grant that was authorized as part of the No Surprises Act, and I'll get into that more in just a minute in another slide. Unfortunately, while the grant program is authorized, it hasn't yet had funds appropriated, and so delays to the grant funding have made it difficult to establish a timeline for completing the APCD. The second broad category of activities is around establishing regulations. While the Senate bill does establish the basic framework, there's a need for administrative rulemaking, as Kyra talked about. Efforts are currently underway to produce the draft regulation, and they'll be presented for public hearing and commentary in a separate process, but we wanted to mention it here today because it is an important part of the overall project. The third basic category is to procure an APCD vendor. There are a number of established vendors out there, and so we're currently in the process of building a request for proposal. And really, much of this session is aimed at helping participants here today understand some of the best practices and guiding principles that are driving procurement, and then to receive any input that you may have about the process of procuring that vendor. And then the fourth is really to work with the selected vendor to stand up or implement the APCD. And as mentioned above, the timing is really heavily dependent on when the grant funding becomes available. The next slide, please. This slide is just about the grant itself. Again, it was part of the Consolidated Appropriations Act of 2021. The portion is known as the No Surprises Act. It includes authorization for the grant for states to either establish or improve an APCD, which includes $2.5 million per state over 3 years. Unfortunately, as I mentioned, the appropriation for the grant has not yet passed, so the funding is not yet available. Several states, though, are working with their congressional delegations to move this through Congress, so we are optimistic that this is going to get moved through and appropriated. Right now, though, there is no date for the funding, nor for the application to become available. So in the next slide, you'll see I'm going to talk a little bit about timeline, and it's a timeline with no dates, which I understand can be a little confusing. But this timeline is a basic idea of how the different activities for the project sort of fall together and where the dependencies maybe are and aren't. So you'll see there's 2 general tracks with the regulations on top in blue and the procurement, funding, and implementation below in green. Now, the draft regulation is not strictly reliant on the grant funding, so we've been working already with the AG's office and the project team to get some draft regulation ready to go.
Jake, we lost your sound.
I'm sorry, I think somebody must have hit mute all. Apologize for that. Where did I drop out?
We missed 30 seconds.
Okay, so the draft regulation is not strictly reliant on the grant funding. Is that about where I was? So we have started working on developing draft regulation to be ready for the next steps, which are the public workshops and public hearings. And so we are working to be as proactive as possible to be ready for those. I believe our plan at this time is to wait on the public hearings and public workshops until we have a more clear picture of when the grant funding will become available, because it does take a lot of many people's time and effort and resources in order to conduct those. And so we're going to try and be as smart as possible with making those fit as sensibly as we can into the rest of the project timeline. And then the section below in green represents the steps required to actually fund and procure and implement the APCD. And you can see those top 2 bars are about the grant writing. And really, it's about waiting until that appropriation happens and then getting the application and processing it as quickly as possible. And then the bottom set of bars is around the procurement and implementation. You can see the RFP that I mentioned before is represented there in that first bar, the draft RFP. That can go through sort of vetting and approval, and that's a big part of what this meeting is about today, is to talk through some of that. And then it'll need to go through CMS approval, and then once the funding becomes available, we can release the RFP, have vendor selection, and then move into the actual implementation portion of the project. I think with that, I will kick it back over.
And I think we're going to go straight to Alicia Hansen with public knowledge to cover the rest of the slides.
Okay, thank you. Again, I'm Alicia Hansen, a consultant with Public Knowledge, assisting with developing the RFP for the APCD procurement. And as APCDs are being developed across the country, many organizations have been releasing recommendations and best practices for effective implementation and operations. We have just a few examples listed here: the California Healthcare Payment Data Review Committee, the State All Payer Claims Databases Advisory Committee released a report. There's an APCD Council that does a lot of reporting and information on best practices, and then various states are releasing reports and information as well. And so we're looking at these recommendations as we are determining the approach for implementing and operating the APCD. The recommendations fall into basically 5 broad categories: data collection, data quality and analysis, data security and privacy, governance of the APCD, and then resources and funding. And what we've really been trying to do is leverage what other states have learned to guide the process while we are following the requirements of SB 40. Since we've already had people down the path learning things, we want to leverage those lessons learned and help our process go more smoothly. So there's slides here about each of the various categories of recommendations. So the first one is data collection. And basically, the recommendations are that data sources should include everything that is available related to claims. So Medicaid, Medicare, and commercial health plans and insurers. The APCD Council has worked with quite a few stakeholders to develop what they're calling a common data layout, or the APCD CDL. And the recommendation is that this be adopted across states to make particularly submissions for payers that have, that cover multiple states, to make it easier for them to submit data. And they're also discovering that monthly data collection allows for more timely analysis and use of the data. And when a state stands up a new APCD, if they can collect some historical data, they're able to put that data to use, looking at trends and changes in the healthcare environment more quickly, so that they have both current data and then also some historical data to work with. In addition to claims data, there are also a fair number of non-claims-based payments that are also done by payers. And if that data can also be collected, it offers a more complete picture of the healthcare system. A lot of recommendations do call for collecting personal identifiable information that allows for some more robust analysis and matching of the data to other data sources to paint a clearer picture of healthcare in the state. But as we mentioned before, there's very specific requirements in SB 40 regarding what of those identifiers need to be removed by the payers before submitting it to the state. We're following the recommendation here of mandatory data submission requirements being stated generally in statute and then defined in regulation. That's exactly what Nevada is doing. And then there are some organizations that are exempt from mandatory reporting, such as ERISA plans. And so the recommendation and SB 40 allows for those plans to voluntarily report. And there's a lot of information around ways to encourage this voluntary submission by sharing the benefits of having this data. So basically, the more complete the data is, the more the analysis can support public health, healthcare quality, cost containment, all of the goals of the APCD. The second broad category is data quality and analysis. And they recommend that stakeholders have access to data quality information so that they understand what's being submitted to the APCD and what can be done with it. And then the use of robust methodologies for any sort of data matching, analysis, quality assurance, any sort of improvement processes is really helpful. And we want to look at that throughout the life cycle of the APCD. So collection, processing, and reporting of the data. And those processes should be reviewed periodically and updated as needed so that we know that we're doing things as effectively as possible. Also, there's a lot of recommendations around working with all the stakeholders that are involved to continue to improve the data collected. There are a lot of data elements that are important for policymaking, but are not often collected on a claim. And so the more of that data that can be collected, the more useful the overall data set becomes. As far as data security and privacy recommendations, the main recommendation really focus on the APCD data being used to look at the overall healthcare system, public health policy, healthcare quality, using aggregated data. This really is to be looking at the system, not to be drilling down into information about specific people or payers or anything like that. It's supposed to be looking at the overall system. So obviously, we need to have, the recommendation is information security program needs to be established that meets all state and federal requirements. Robust security and privacy processes need to be in place to protect individual patient privacy and prevent identification of any individual. Obviously, access to any sort of non-public data needs to be limited, and comprehensive data reporting and release policies should be established to ensure that the data is being used appropriately. As far as governance recommendations, this goes just beyond even just data governance to actual governance of the APCD. And so states are really recommending that a robust program with appropriate oversight for data use and release be established, and that the entity that is responsible for managing the APCD be clearly designated. And there's also recommendations for policy advisory committees or other committees to help provide the guidance to manage and use the APCD. And that's one of the requirements of SB 40, that regulations be put in place to establish those kinds of advisories. And then last but not least, there's a category for resources and funding recommendations. And basically, states are finding that the more they can leverage existing expertise, the more quickly their APCDs are implemented and become productive and useful. So taking advantage of subject matter experts, people who already are familiar with claims data, familiar with the APCD space, is very helpful. So most states are looking to implement APCDs with established vendors and modular approaches. And then they're exploring potential funding sources, which can include CMS or fee-based products, reports and things that can be developed from the APCD data. And then a lot of states are also recommending that as funding sources are identified, if a fund can be established that allows money to be used in future years, that helps promote sustainability of the APCD. So as we are keeping the requirements of SB 40 in mind and looking at these recommendations from across the country, there's a few key items that we're keeping to the forefront of our work on the procurement. DHHS will be seeking a vendor with established APCD experience through the RFP process. The vendor will be responsible for implementing and maintaining the APCD system, working with data submitters, and then data processing and management. All data requests, analysis, and reporting will be handled by the Office of Analytics within DHHS. And as Jake talked about with the challenges with the grant funding, the RFP will not be released until the grant funding is secured. So with that wraps up the information that we had prepared today. There's contact information for Kyra, Jake, and myself if you need to reach out. But there has also been a listserv set up so that as information becomes available, the FAQs from this meeting, those kinds of things are available. Information will be pushed out through that listserv. So you can visit the DHCFP website at the URL on this slide and sign up to receive information from that listserv. And with that, I will turn it back over to Jake for additional public comment per the agenda.
Okay, thanks, Alicia. So I will direct traffic for this last segment here for public comment. I'll give you a little reminder about a couple of things we talked about earlier in the meeting. If you have questions, we will be happy to take those questions. Thank you for them, record them, and we will use them in FAQs if appropriate. You may submit questions or comments through the chat box still in Microsoft Teams. Please feel free to do that. All comments will be recorded and reviewed by the state. And then now will be a designated time for public comment, voice comment. Please raise your hand in Microsoft Teams if you have a comment to make. I will then invite you in order to unmute and share your comment. Please do limit your comments to 3 minutes. If you've joined by the Teams app or through a browser, please use the Teams controls to raise your hand and unmute when invited. Again, a reminder, if you've joined by audio only via dial-in, you may press *5 to raise your hand, and then it will be *6 to unmute yourself when invited. If you need a list of all audio-only commands, please press *1. At this time, I will go ahead and open it for public comment. Helen Foley, please feel free to unmute and provide your comment. And again, I'm sorry, Helen, just before you do that, I'd like to remind everybody when you do unmute to make your comment, please state your name, title, and affiliation. Go ahead, Helen.
Have I unmuted? Can you hear me?
Yes, ma'am. Yes.
Thank you very much. My name is Helen Foley, and I represent the Nevada Association of Health Plans. And we are very pleased that you plan on leveraging what other states have already learned from this process. Certainly, the insurers that are part of our association also are in those 24 states that currently have the APCD program up and operational. So we want to work very cooperatively with you. We want to make sure that any vendor that you hire to collect data has the high trust certification and that they're excellent in analytical skills. We want to provide our services to you, our experience from all of these other states as you develop this RFP so that we can get the very best vendor out there. So thank you very much, and we look forward to your next meetings.
Thank you. And at this time, we don't have any other hands raised. We'll give it a few more minutes. If anybody has a comment they'd like to make, please raise your hand. Yes, I see Leah Case. Again, please state your name, title, and affiliation, and feel free to unmute.
Hi, thank you, Leah Case. Just wondering if this PowerPoint presentation is posted anywhere online. I didn't see it on the DHCFP notice website. That's all, just logistics. Thank you.
It is not currently posted, but it will be posted with the meeting minutes. Thank you for the question. That's one I actually can't answer in the meeting. And again, just a few more moments for anybody to raise their hand. Yes, Kelly Williams. Again, please state your name, title, and affiliation.
Yes, my name is Kelly Williams. I am a regional vice president with Maximus. And I just wanted to say thank you. You know, having these types of meetings and really understanding where opportunities are coming from, what your goals and visions are, and what are the things you want us to do is extremely helpful. So thank you for this wonderful presentation and taking the time to spend time with us.
Thank you for your comment. And again, we'll give it a few minutes if anybody else would like to raise their hand. Okay, Alicia, if you could go back to the contact information slide. Again, this information will be available out there for anyone to reach out with future comments or questions. And more information, of course, will be coming when we get into the regulation process. Any of the other presenters have any final comments before we adjourn?
I appreciate the attendance today. Thanks for being here.
Hear, hear.
Yes, thank
Robust
you.
attendance, and we appreciate your time.
Definitely. Thank you.
All right, then I will call this meeting adjourned. Thank you, everybody, for attending. Have a great day.
Thank you.